everyone! For my independent study project, I dove into the long-term psychological effects of cancer in young adult survivors. This topic stood out to me because young adulthood is a stage where people are typically building careers, forming relationships, and gaining independence. When cancer interrupts this journey, it can leave emotional impacts that don't always heal once treatment ends. I wanted to better understand how these survivors process their experiences and what kind of support they need, not just physically, but mentally and emotionally. To explore this, I listened to an Oncology Nursing Society podcast called Navigating Life After Cancer, AYA Survivorship Challenges, which includes insights from healthcare professionals and young adult cancer survivors themselves. Second, I read selected stories from the book Hope in the Face of Cancer by CanCare, which includes a collection of first-person narratives written by survivors across all different backgrounds. Together, these resources gave me a deeper understanding of what survivorship looks like for young adults, and how psychological effects can continue for years after the physical disease is gone. First, I'm going to be reviewing topics that were discussed both in my independent study and our coursework. The themes explored in my independent study closely paralleled the content and theories presented in our course, particularly those that are related to holistic and developmental survivorship care. A major connection emerged around the transition theory, which emphasizes the need for structured support when patients move from active treatment to survivorship. In the Oncology Nursing Society podcast, several adolescent and young adult survivors reported feeling unprepared to be abruptly cut off from their care teams once treatment ended. And one participant stated, "The chemo ends and suddenly everybody disappears." This reflects what we learned in Module 3 about the nurse's role in reducing distress during care transitions by offering continuity, education, and follow-up. Additionally, uncertainty in illness theory was deeply reflected in survivors' expressions of lingering fear and lack of clarity about their futures. The ONS podcast described how young adults often fear reoccurrence without even knowing what signs to look for. And one speaker explained, "I had no idea what was normal pain and what was supposed to scare me." As covered in our course, reducing uncertainty through tailored education on what to anticipate is a key nursing implication and responsibility. Lastly, survivor narratives illustrated the principles of resilience theory, which we explored as a framework used frequently in survivorship care. Several individuals in Hope in the Face of Cancer described facing their diagnosis despite their past hardships. One young man shared, "I had been through foster care. I knew how to survive. Cancer didn't get to define me." As discussed in the lecture, resilience is not fixed. It can be developed through positive coping strategies, goal setting, and nurse-guided empowerment. Together, these examples highlight how transition, uncertainty, and resilience are not just theoretical, but deeply embedded in young adult survivor experiences. They also support the nurse's role in recognizing and responding to the complex needs of young adult cancer survivors. Moving on to the first key point I learned is that survivors often feel pressure to appear emotionally strong, even when they're struggling internally. One of the most impactful takeaways from Hope in the Face of Cancer was how many young survivors suppress their emotional pain to avoid burdening loved ones. For example, one young woman explained, "I smiled through the worst of it because I didn't want to scare my parents, but I was terrified every day." This sense of emotional performance can lead to internalized anxiety, depression, and a lack of support because survivors may not feel safe expressing how they truly feel. For nurses, this highlights the importance of actively screening for emotional distress, even when the patients appear outwardly positive. We can't assume patients are coping well based on their demeanor. Survivors in this situation need compassionate, judgment-free spaces where they feel permitted to be vulnerable. Nurses can encourage that through open-ended questions, therapeutic communication, and referrals to counseling or peer groups. By validating emotional discomfort and making it clear that it's normal and acceptable, nurses can help lessen the pressure to appear strong and encourage more effective healing. Additionally, survivors frequently struggle with the loss of independence and autonomy. The Oncology Nursing Society podcast revealed how cancer forces many young adults to give up the independence they had just began to experience. One participant said, At 21, I was living on my own. By 22, I was back in my parents' house and needed help getting to the bathroom. This reversal from autonomy to dependence created significant emotional strain with survivors describing feelings of embarrassment, helplessness, and even shame. Nurses need to be aware that young adult survivors may be grieving not only their health but also the freedom and sufficiency they had worked hard to establish. In response, nurses can offer developmental care that promotes self-care and independence, even in small ways, such as involving patients in care decisions or providing resources to help them regain control over their routines. Lastly, survivors may experience a loss of connection with peers who haven't gone through cancer. Another key insight from Hope in the Face of Cancer was how isolating the survivorship experience can be, especially when young adults find it difficult to relate to peers who haven't faced a life-threatening illness. One survivor shared, "All my friends were planning post-grad trips. I was planning when I could take my next pain med without throwing up." Survivors often describe feeling emotionally distanced from their social circles, not because of lack of love or support, but because others simply can't relate to the physical and emotional toll of cancer. This social disconnect can lead to feelings of loneliness, alienation, and resentment, particularly when survivors are surrounded by people whose lives seem to be moving forward. For nurses, this highlights the importance of referring patients to age-specific support systems. Survivors in this position may benefit from connection with others who have faced similar experiences through cancer support groups or online communities specific to their age group and diagnosis. Nurses can help normalize these feelings of social disconnection and offer outlets for connection. Creating a sense of belonging can be a significant part of the healing process. Another observation that I made was that dating and romantic relationships become unusually complicated for young survivors. One observation from Hope in the Face of Cancer was how several young survivors struggled with dating after treatment. One woman shared, "Do I tell him I had cancer on the first date? The fifth? What if they can't handle it?" Navigating intimacy and disclosure was described as nerve-wracking, especially with fears about fertility, scars, or recurrence. For young adults who are often beginning to form long-term romantic connections, this adds a layer of complexity that peers may never have to consider. Additionally, career ambitions are often put on hold, sometimes indefinitely. In the Oncology Nursing Society podcast, a young survivor reflected, "I had just landed my dream internship in New York. Then the diagnosis hit, and everything stopped." For young adults just entering the workforce, cancer often means stepping away from plans at a very pivotal time. Even after treatment, some survivors reported feeling behind from their peers or hesitant to return to work environments due to fatigue or health anxiety. This interruption often altered their entire professional trajectory. As a conclusion, this independent study has enhanced my understanding of the long-term psychological and social effects of cancer survivorship in young adults. Survivors in this age group face a distinct set of challenges, including disrupted identity formation, ongoing emotional distress, and financial and career-related instability. These issues do not resolve when treatment ends, but instead they can evolve into long-term factors that shape the quality of life and maybe even worsen it. As I move forward in my nursing education and further clinical practice, I will apply this understanding by prioritizing mental health screening, advocating for accessible emotional support resources, and promoting survivorship care that addresses the whole person. This experience supports the importance of holistic nursing. This is care that extends beyond treating the illness to encompass the emotional, psychological, and social dimensions of recovery. Thank you all for listening.